Brandon, we live in a much more connected world than ever before. People are used to looking globally for all sorts of things: products, information, even travel experiences. It's not surprising that this mindset has extended into healthcare, with people exploring options for medical and dental care outside of their own country.
That's very true, Russ. The concept of medical or dental tourism has certainly become more visible. While the idea of combining travel with healthcare can seem appealing, especially when significant cost savings are advertised, it introduces a host of complex variables and potential risks that patients need to understand very clearly, particularly when it involves complex surgical procedures like those in our specialty.
And that's exactly what we feel is important to discuss today. It's a conversation that requires a careful and honest look at the perceived benefits versus the often overlooked risks. Welcome everyone to Oral Surgery Insights. I'm Dr. Russ Lieblick and Dr. Brandon Rehrer is with me. Today we're providing our perspective on a topic many patients are curious about: dental tourism and whether it's a wise choice for oral surgery.
Our goal here is not to be alarmist, but to be advisory. We want to equip our listeners with the right questions to ask and the critical factors to consider, so they can make a truly informed decision that prioritizes their long-term health and safety above all else.
To start, it's important to acknowledge the primary reason patients consider dental tourism. Let's be very direct about it. The main driver is cost. The advertised prices for major procedures like full-arch dental implants or other extensive reconstructions in some other countries can be a fraction of the cost as in the United States.
And we understand that. The cost of healthcare in the U.S. is a significant concern for many families. When patients see an online advertisement for a complete smile makeover at a 50 to 70% discount, combined with a stay in a beautiful resort location, the appeal is undeniable.
It's marketed very effectively as a two-for-one opportunity. Get your complex dental work done while enjoying a vacation. For someone who has been putting off necessary treatment for years due to financial concerns, that can seem like an incredible, once-in-a-lifetime solution.
But our experience as surgeons, particularly in sometimes having to manage the complications from these situations, compels us to look beyond that attractive surface-level appeal. It's our responsibility to discuss the hidden costs and significant risks that are often not part of that glossy marketing brochure.
A good place to begin is with the standards of care, something patients in the U.S. might take for granted. Here, our practices are subject to incredibly stringent regulations at multiple levels.
That's correct. State dental boards provide oversight and licensure, ensuring practitioners meet specific educational and ethical standards. We adhere to strict infection control and sterilization protocols mandated by organizations like OSHA and the Centers for Disease Control, or CDC. Our use of sedation and anesthesia is also highly regulated to ensure patient safety. These standards are rigorously enforced.
That regulatory environment is not consistent globally. While there are certainly excellent clinicians and facilities in other countries, there are also many places where the standards for sterilization, emergency preparedness, and provider credentialing may be significantly different or less stringent than what is legally required here. That difference in regulatory oversight can be one of the sources of cost savings.
The materials and components used are another major consideration, especially with dental implants. The dental implants we use in our practice are from major, reputable manufacturers who have decades of clinical research, extensive scientific documentation, and robust long-term data supporting the efficacy and safety of their products. They are cleared by the FDA for use in the United States.
A dental implant isn't just a generic titanium screw. The specific surface treatments, the precision of the connection to the final crown, and the quality of the materials are all critical for long-term success and for preventing complications like implant fracture or peri-implantitis.
In some international markets, there's a proliferation of what are known as clone or generic implant systems. These may look similar to the major brands, but often lack the same level of research, quality control, and long-term clinical validation. Using a less proven system can be another way that costs are reduced, but it introduces a significant unknown into the patient's long-term health.
Beyond the regulatory and material aspects, the very process and timeline of treatment in a dental tourism model often contradicts fundamental biological principles of healing. Complex oral surgery is a process, not a single event.
That's a critical point. A proper treatment plan begins with a thorough, in-person consultation and diagnostic workup. This allows us to fully assess the patient's health, understand the nuances of their anatomy from 3D scans, and develop a customized plan. In a tourism scenario, this crucial planning phase is often rushed, done remotely with incomplete information, or sometimes condensed into a single day.
We also see a major issue with compressed treatment timelines. For example, a full mouth reconstruction with implants is often staged over several months here in the US. We might remove failing teeth and perform bone grafting, then allow the bone to heal and mature for 4 to 6 months before placing the implants. This allows for a more predictable and stable foundation.
The dental tourism model often compresses this entire complex process into a 1 or 2 week time frame to fit a travel schedule. This can mean placing implants into infected sites without adequate healing, or loading them with immediate teeth in situations where the bone quality is not sufficient. Rushing the biology of healing can significantly increase the risk of infection and implant failure.
And then there is the most critical question of all. What happens when you get home? Oral surgery requires careful post-operative monitoring and follow-up. What if a patient develops an infection 2 weeks after they return home? What if a component comes loose a month later?
Flying back to the original country for a follow-up visit is often impractical or impossible. So, the patient is left to find a local surgeon to manage the complication. This places both the patient and the local surgeon in a very difficult position.
It does. We may not know what type of implant system was used, what materials were placed for a graft, or what the original surgical plan was. There are often no accessible records. It can be incredibly challenging and sometimes impossible to properly manage a complication without that essential information. For liability and clinical reasons, many surgeons are understandably hesitant to take on the responsibility of fixing complex work performed outside of the country under unknown circumstances.
This leads directly to the issue of complication management and legal recourse. Even in the most skilled hands here in our own practice, complications, while infrequent, can and do occur. Biology is not always predictable. However, when a complication arises, we have an established immediate system for managing it. The patient calls us, and we see them right away.
That immediate access to the surgeon who performed the procedure, who knows exactly what was done and is responsible for the outcome, is a vital part of the patient's safety net. That safety net completely disappears the moment you fly home from another country. You are effectively on your own to navigate any post-operative issues.
And from a legal and regulatory standpoint, if a patient experiences a significant negative outcome or negligence here in the United States, there are established avenues for recourse through state dental boards and the legal system. These patient protections are in place to ensure accountability.
Those same protections and standards of accountability often do not exist for a foreign patient receiving care in another country. Navigating a malpractice claim across international borders is an incredibly complex, expensive, and often impossible task, leaving the patient with little to no recourse if something goes wrong.
So, when we revisit the initial appeal, the lower costs, it's essential to factor in these significant risks. That advertised savings does not account for the potential future costs.
What if there's a complication that requires extensive treatment back home? The cost of managing a single failed implant or treating a significant infection can quickly erase any initial savings. In a worst-case scenario, the cost to repair the damage can end up being far more than the original cost of having the procedure done locally in the first place.
It's also about factoring in the non-financial costs, the physical and emotional toll of dealing with a complication, the time lost from work, and the stress of trying to find someone to help you.
This really brings the discussion back to the concept of value. The value of receiving care in your local community from a surgeon and a team you have met, consulted with, and built a relationship with is immense. The value of knowing that the person who provides the surgery is the same person who will manage your healing and be there for you in the years to come provides incredible peace of mind.
That continuity of care, from the initial planning stages through long-term maintenance, is a core component of a high-quality healthcare outcome. It's a crucial part of the overall value that is often absent in the dental tourism model.
So, our professional advice for anyone considering dental tourism for complex oral surgery is to proceed with extreme caution. The allure of a lower price tag can be very strong, but it's vital to look deeper and consider the whole picture.
We encourage patients to ask critical questions. What are the credentials of the surgeon? What specific implant system and materials will be used? And are they supported by long-term research? What are the protocols for sterilization and infection control? And most importantly, what is the plan for managing any post-operative complications once you have returned home?
We believe that prioritizing safety, quality of care, accountability, and a trusted long-term relationship with your local surgical team is the wisest investment in your health. While the upfront cost may be higher, the long-term value and peace of mind are, for most people, Well worth it.
A successful surgical outcome is not just about how things look the week after the procedure. It's about ensuring function, stability, and health for years and decades to come.
A very important consideration for anyone making these significant healthcare decisions. We hope this discussion has provided a balanced and helpful perspective on the topic of dental tourism. Thank you for joining us for Oral Surgery Insights.
We appreciate you spending your time with us today, and we trust this conversation has been informative and empowering.
We wish you all the best in your health journey.